Hi guys. Hi guys. So yes, we are live again. Uh, Welcome to Unacademy, guys. Welcome back. So this is the continuation session. We have started with the MCQs of the CNS topic, and till now we have completed around 250 MCQs. And from this session, we'll be starting from 251 and we have to complete till 350. Let's see how many we can do. And yeah, let's start, guys. So it's the basic principle that if you want to watch the live special classes on an Academy app, then you have to install the Unacademy app, right? So from Play Store or App Store, you have to write the Unacademy, and you can install this app. And if you want to buy the plus subscription, then you can use the code VIRMANI, and you will be getting 10% off. And yeah, let's start the MCQs. So let's directly jump to the 250th MCQ. Yes, so this is the 251st, and yeah, let's start. So the drug used to treat extrapyramidal symptoms due to or syndrome due to phenothiazines is, so the drug that is used to treat the extrapyramidal symptoms due to phenothiazines is, so yeah, this is the first MCQ of this session, and your time starts now. So 10 seconds are left. Yeah. So the drug that is used to treat the extrapyramidal symptom due to the phenothiazines is benzhexol. Benzhexol. And let's move to the another question, 252. True statement regarding the lithium toxicity is, true statement regarding the lithium toxicity is increased by increased serum sodium levels, increased by decreased serum sodium levels, increased in acute tubular necrosis, and appears when the serum level becomes triple the dose of therapeutic level. These are the four options, and your time starts now. 10 seconds are left. So 252 का आंसर is B, increased by decreased serum levels, right? Increased by decreased serum sodium levels, right? So there would be more sodium. When more sodium is going to the urine, then lithium is reabsorbing into the body. समझ पा रहे हो I hope. And B is the correct option. Then comes the 253rd question. Which of the following antidepressant cause urine retention? And these are the four options: imipramine, fluoxetine, dothepin, and risperidone. So 253 ka what is the correct option, guys? And your time starts now. 10 seconds are left. Yes. So guys, what is the correct answer? Which of the following antidepressant can cause urine retention? So which is the correct answer? So that is A, imipramine. A is the correct answer, imipramine, right? And 254th पे हम आए हैं तो antidepressant drug that can be safely used in children is imipramine, fluoxetine, dothepin, and risperidone. So imipramine, fluoxetine, dothepin, and risperidone. And your time starts now. 10 seconds are left, guys. 5, 4, 3, 2, and 1. And the antidepressant that can be given or that is used in children is, guys, basically fluoxetine. Fluoxetine is the correct drug. Now comes the 255th question. Coarse tremors, dysarthria, ataxia are side effects of lithium, haloperidol, imipramine, or none. So lithium, haloperidol, imipramine, or none. So what is the so basically कौन सी drug ये side effect cause कर सकती है? Which drug can cause these side effects? Your time starts now. 5, 4, 3, 2, and 1. And guys, these side effects are produced by which drug? Which drug? By lithium. So lithium is the drug that can cause cold tremors, dysarthria, and ataxia. Now comes the Tranylcypromine MAO inhibitor should be avoided in dash as it can cause dangerous drug reaction. So morphine, amitriptyline, alprazolam, any of the above. Right. So your time starts now. 5, 4, 3, 2, and 1. So guys, ये तो आपको पता ही होगा कि MAO inhibitor के साथ which drug should be avoided? Amitriptyline should be avoided. Right. So amitriptyline is correct. And 257th पर हम आए हैं तो which among of the following is not an antipsychotic drug? So risperidone, haloperidol, fluoxetine or clozapine. So which among the following is not an antipsychotic? Risperidone, haloperidol, fluoxetine and clozapine. So your time starts. So 5 seconds are left, and yeah, we are having the correct answers. And uh, which of the following is not an antipsychotic, guys? C. Fluoxetine. बाकी risperidone, haloperidol, and clozapine they all are antipsychotics. Galactorrhea is caused by phenothiazines, bromocriptine, pyridoxine, or none. So your time starts now, and you will be getting 30 seconds. So what is the correct answer, guys? So correct answer is A. Phenothiazines. Galactorrhea is caused by phenothiazines. And let's move further. 259. Common side effect of chlorpromazine are all except. So common side effects of chlorpromazine are all except osteoporosis, Parkinson's disease, skin rash, amenorrhea. So what are the side effects, guys? Uh, so your time starts now. So guys, we are having the answers, but still we are having 5 seconds. So yeah, uh, yeah, osteoporosis. So osteoporosis is the correct answer. So chlorpromazine, it can cause Parkinson disease, can cause skin rash, can cause amenorrhea, but it cannot cause osteoporosis. So this is the correct answer. 260 की अगर हम बात करें, all are selective serotonin reuptake inhibitor except all the drugs are SSRI except. So drugs are fluoxetine, fluoxamine, paroxetine, and osmapine. So your time starts now. 10 seconds left, and we are having our answers. And answer is D, amoxapine. Amoxapine is not a SSRI inhibitor. Fluoxetine, fluoxamine, and paroxetine, these are all SSRI inhibitors and SSRIs, right? And 261 पर हम आए हैं. All are atypical antipsychotic drugs except clozapine, risperidone, olanzapine, loxapine. So कौन सी drug is uh, not an atypical antipsychotic? Your time starts now. So what should be correct, guys? What's wrong with the chat, man? Why it's not visible? Yeah. So we are having our answers, that is D, loxapine. So 261 ka answer is D. Loxapine is not an atypical antipsychotic. Clozapine, risperidone, and olanzapine. These three drugs are atypical antipsychotic. Then we are having our 262 question. Treatment of malignant neuroleptic syndrome include all except chlorpromazine, dantrolene, peripheral cooling, and diazepam. So your time starts now. Ten seconds are left, and yeah. What is the correct answer, guys? So देखो. So correct answer is देखो मैं बस समझाता हूँ. A. Correct answer is A, chlorpromazine. Why chlorpromazine is correct? Because chlorpromazine can itself cause malignant neuroleptic syndrome. So it cannot be used as the treatment. Dantrolene is the drug of choice that should be used. Peripheral cooling is prescribed plus diazepam is given because neuroleptic syndrome can cause seizures as well. तो इसके अंदर सीजर होने के चांसेस होते हैं. देन सीजर के लिए द करेक्ट ड्रग शुड बी डायजेपम. तो बी, सी एंड डी are the drugs or the treatment of malignant neuroleptic syndrome, but a chlorpromazine should cannot be with the chlorpromazine we cannot treat malignant neuroleptic syndrome. And now comes the 263 question. Long-term antipsychotic use may cause long-term antipsychotic may cause depression, mania, schizophrenia, or tardive dyskinesia. So this is a really very easy question, and your time starts now. This is really very easy question. Very easy question. 10 seconds are still left. So yeah, we are having our answers, and time is also over. So long-term antipsychotic drugs may cause tardive dyskinesia, which is EPS, extrapyramidal syndrome का symptom is tardive dyskinesia, right? So depression, mania, schizophrenia, no. It can cause tardive dyskinesia as it's the side effect, right? And 264 पे हमारे moclobemide. So what is a moclobemide? So moclobemide is a SSRI, antipsychotic, MO inhibitor, tricyclic antidepressant. So what is moclobemide? And your time starts now. And it is also a very easy question. It is a really very easy question. Moclobemide wala question is really very easy. 10 seconds are left. So guys, what is the correct answer? C is the correct answer. We are having our answers. C is the correct answer. MAO inhibitor. Moclobemide is a MAO inhibitor. Monoamine oxidase inhibitor. And 265th paramaya. And which of the following is not associated with increase in prolactin? Haloperidol, chlorpromazine, hydroxy, sulfuride, and Q-tapin. So which drug which drug is not associated with the increase in prolactin or hyperprolactinemia? So haloperidol, chlorpromazine, hydroxysulfuride, Q-tapin. And your time starts now. It's also a very easy question, guys. So time is over, and what is the drug, guys? What is the drug, guys? The drug is Q-tapin. So, Q-tapin cannot increase the prolactin, but haloperidol, chlorpromazine, hydroxysulfuride, these drugs can increase prolactin. So, pimozide belongs to class of thiothixine, phenothiazine, butyrphenon, diphenyl butyl piperidine. So, time starts now. Time starts now, and no, time starts now. Only 10 seconds are left. And Pimosite belongs to which class? 5, 4, 3, 2. Pimosite belongs to diphenyl butyl piperidine, that is D. Pimosite belongs to D, right? And let's move to the another question. 267th, antipsychotic drug with the longest elimination half-life is antipsychotic drug with the longest elimination half-life is aripiprazole, loxapine, quetiapine, ziprasidone. So antipsychotic drug with the longest elimination half-life. So the which drug is this? And your time starts now. And 267th का बताओ फटाफट से. Uh, let's see. Antipsychotic drug with the longest elimination half-life. Hmm. 5, 4, 3, 2, and 1. And guys, aripiprazole. So antipsychotic drug with the longest elimination half-life is aripiprazole. Aripiprazole is the drug, right? And now, 268th question. Dopamine and noradrenaline reuptake inhibitor is clozapine, bupropion, zolpidem, mirtazapine. तो 268 का क्या आंसर है गाइस? क्या आंसर है? लेट्स सी. So, which is the correct answer, guys? B. Bupropion is correct, guys, and yeah, tech number you are also right. And 269 from IM. So, which of the following is not a MAO inhibitor? MAO inhibitor. Which of the following is not a MAO inhibitor? Tricyclic promine, isocarboxazide, phenelzipine, maprotilin. So, which is not a MAO inhibitor. And your time starts now. So, guys, इसका आंसर is still we are having 5 seconds. 5, 4, 3, 2, and 1. D is correct. Maprotilin. So this is a TCA. Maprotilin comes under TCA. Right, tricyclic antidepressants. Baki all these three are monoamine oxidase inhibitor. And now comes the 270th question. The clinical indication of TCAs, tricyclic antidepressants, include all of the following except enuresis in early subjects, elderly subjects, neuropathic pain, panic disorder, uncontrolled seizures. So the clinical indication of TCAs include all the following except enuresis in elderly subjects, neuropathic pain, panic disorder, and uncontrolled seizure. So your time starts now. So guys. Answer is answer is D and uncontrolled seizure. So clinical indication of TCAs are all include basically enuresis ये enuresis के लिए imipramine is indicated right. This but D uncontrolled seizure. We cannot use TCAs in uncontrolled seizures. These things are really easy things. And 271 per aya, which of the following statement is not correct of tardive dyskinesia? So it is an unwanted effect of antipsychotics. Levodopa exacerbates the symptoms. Antimuscarinic drug reduces its severity. Often diazepam is used to bring improvement. So you have to select the false statement, right? And your time starts now. I think इस क्वेश्चन में थोड़ा सा हाँ एरर नहीं है इस क्वेश्चन में एरर नहीं है बट लग रहा था you have to find false statement and 3 2 and 1 yeah so आपका टाइम खत्म हो चुका है and correct is B so basically it is tardive dyskinesia that is unwanted side effect of antipsychotics this is true then anti-muscarinic drug reduces its severity yes this is also true then often diazepam is used to bring improvement generally it is not used but yeah it can be used then B levodopa exacerbates the symptoms no levodopa can improve the symptoms right because these things are generally due to the deficiency of dopamine and let's move further Haji Parag. So 272 question पर आते हैं which of the following medication is associated with an increased risk of A granulocytosis A is clozapine B is imipramine C is lithium and D is haloperidol and your time starts now. Ten seconds are left. Yeah, we are having correct answers as well. So 3, 2, and 1. So yeah, clozapine is correct, guys. Which of the following medication is associated with an increased risk of A granulocytosis? Clozapine. And let's move further. The side effect of lithium used in psychiatry practice include all except nausea, vomiting, tremors, hypothyroidism, hypercalcemia. And your time starts now. 15 seconds are left. So yeah, we are having answers. We are having the correct answers. That is the hypercalcemia. So lithium can cause nausea, vomiting. Lithium can cause tremors. Lithium can cause hypothyroidism, but lithium cannot cause hypercalcemia. And 274 की बात करूँ तो drug of choice for the treatment of negative symptoms of schizophrenia is so the drug of choice for the treatment of negative symptoms of schizophrenia is chlorpromazine, haloperidol, clozapine, or doxepin. So your time starts now, and let's see who answers the first. Actually, my phone is not charged. Let's see कब तक चलता है ये. 5, 4, 3, 2, and 1. So drug of choice for the treatment of negative symptoms of schizophrenia is C. Clozapine. So clozapine is the drug of choice for the negative symptoms of schizophrenia. And 275th पर आते हैं. So which among the following medication has been found to be effective in smoking cessation? Bupropion, buspirone, paroxetine और venlafaxine. तो इसके अंदर अच्छे से समझ के जवाब देना and your time starts now. Fifteen seconds are left. So guys, my phone is not charged 1% है, so कभी भी switch off हो सकता है. तो लाइव चैट देखने के लिए फोन ही चाहिए होगा. तो आई एम रियली सॉरी गाइस, मैं एक बार जाके फटाफट से चार्जर ला रहा हूँ. प्लीज डोंट माइंड. फोन yeah. And yeah, time is also over. And bupropion is the drug that is found to be effective in smoking cessation, right? And and now comes the 276 question. Drug of choice for nocturnal enuresis. Drug of choice for nocturnal enuresis. फटाफट से बताओ. Your time starts now. It is really very easy question. And guys, in this session we will be trying to do till 350th MCQ. तो अभी हम 276 पर पहुंच चुके हैं and till 350 तक पहुंचेंगे. uh, Yeah, answer आ चुका है and still we are having 10 seconds. Yeah, imipramine is the drug. You all must be knowing imipramine is the drug that is used for the nocturnal enuresis. And then comes the 277 question. A patient presents with a malignant hyperthermia and metabolic acidosis. Immediate treatment should be started with. So immediate treatment should be started with IV dantrolene, sodium bicarbonate, IV fluids, or paracetamol. So guys, correct option is A, IV dantrolene. So patient present with the malignant hyperthermia and malignant and metabolic acidosis. So immediate treatment should be IV dantrolene. And 278 is dysphoria caused by opiates is mediated by which receptor? Dysphoria caused by opioids is mediated by which receptor? Mu, kappa, delta, or sigma. Mu, kappa, delta, or sigma. So dysphoria caused by opiates is mediated by which receptor? I hope this you all must be knowing. So that is mu. Mu is the receptor जिसकी वजह से dysphoria होता है. So we have studied that mu receptor sacrum is the mnemonic. So sacrum is the mnemonic and या हमने ये पढ़ा था कि म्यू रिसेप्टर कॉजेज डिस्फोरिया बाकी और जो थे म्यू kappa एंड डेल्टा तो ये तीनों जो थे बेसिकली एनाल्जेसिया kappa एनाल्जेसिया डेल्टा एनाल्जेसिया बट म्यू के काफी सारे फंक्शंस थे राइट सो उसको फंक्शन को हमने सैक्रम की फॉर्म में याद करा था राइट एंड 279 पर हम आए हैं सो प्रेफर्ड ड्रग फॉर अल्कोहल विड्रॉवल सीजर इज preferred drug for alcohol withdrawal seizure is you all must be knowing this हमने अच्छे से डिस्कस करा था ये डी एडिक्शन opioid डी एडिक्शन के अंदर so what should be the correct answer still you are having 15 seconds so yeah time is over and preferred drug for alcohol withdrawal seizure is diazepam so we have talked about this thing कि alcohol withdrawal सीजर के ड्रग ऑफ चॉइस इज डायजेपम राइट 280 की हम बात करें तो all are true regarding methanol poisoning except all are true regarding methanol poisoning except hemodialysis should be done when serum methanol concentration is above 50 mg per dl. Then fomepizole acts by inhibiting LDI dehydrogenase. High anion gap metabolic acidosis is seen in severe cases, and the visual disturbances are commonly seen. So 280th ka time starts now, and what should be the correct answer? So what should be correct is 5 seconds are left. So we are having a correct answer, that is all are true regarding methanol poisoning except B. Fomepizole acts by inhibiting aldehyde dehydrogenase. Yes, right. And basically, hemodialysis should be done with when serum methanol concentration is of this. Yeah, this is true. High anion gap metabolic acidosis is seen with severe cases. Yes, this is also true. Visual disturbances are commonly seen. Yeah, but fomepizole acts by inhibiting aldehyde dehydrogenase. No. Then 281 की हम बात करते हैं. Young man is with known heroin addiction is brought in the emergency in unconscious state. On examination, the patient has decreased bowel sound, depressed respiration, and pinpoint pupil. The treatment of choice for this patient is, so a young man is with known heroin addiction is brought in the emergency in unconscious state. On examination, the patient had decreased the bowel sounds, depressed respiration, pinpoint pupil. The treatment of choice for this patient is, so your time starts now. So guys, time is over and the correct answer is B, IV naloxone. So young man is known is with known heroin addiction. So हमें de addiction करना है, right? So IV naloxone is the treatment of the choice for this, which basically he is on the toxicity, right? Toxicity पे है. So opioid की toxicity पे have a patient. So to decrease the toxicity or to treat that opioid toxicity, so IV naloxone is used. And 282 पे आते हैं तो which among the following drug is contraindicated in renal failure? So which among the following drug is contraindicated in renal failure? One is methadone, second is morphine, then fentanyl, and then atracuria. तो 282 का क्या आंसर हुआ? So which drug is contraindicated in renal failure? So the correct option is A, pethidine. Pethidine is absolutely contraindicated in renal failure. And 283rd question is all of these are the adverse effects of naloxone in the treatment of opioid poisoning except. So naloxone के adverse effects की बात हुई है. Hypertension, pulmonary edema, seizures, ventricular dysarrhythmia. So what should be correct, guys? So your time starts now. Ten seconds are left. And yeah, we are having the correct answer. That is C. And yeah, seizure is the correct answer. All of these are the adverse effects on naloxone like hypertension, pulmonary edema, ventricular dysarrhythmia, but seizure nahi ho sakta. Now comes the 284th question. All of the following can be used to treat alcohol dependence except. So all of the following can be used to treat alcohol dependence except naltrexone, acamprosate, flumazenil, and disulfiram. So naltrexone, acamprosate, flumazenil, disulfiram. So what should be correct? You are having 30 seconds. Yeah, we are having answer as well. So yeah, time is over. And what should be correct, guys? What is the correct answer? The correct answer is flumazenil. So alcohol dependence can be treated by disulfiram, can be treated by acamprosate, can be treated by naltrexone. But flumazenil के साथ नहीं treat हो सकता. Flumazenil is the antidote for benzodiazepine. Then there is the another question, that is rave drug is cannabis, cocaine, heroin, amphetamine. So your time starts. 5 seconds are left, guys. And rave drug is nothing but amphetamine. So rave drug is a amphetamine. एंड 286 की बात करें तो विच ऑफ द फॉलोइंग ड्रग इज यूज्ड वर्ल्ड फॉर द मेंटेनेंस थेरेपी ऑफ opioid डिपेंडेंस? Naltrexone, methadone, pethidine, or L-name. So, which of the following drug is used worldwide for the maintenance therapy of opioid dependence? Which drug? So, your time starts now. Twelve seconds are left. So, guys, which of the following is the worldwide used maintenance therapy of opioid dependence is methadone. So, methadone is, अगर आपको नहीं पता, methadone is opioid agonist only, but it is longest acting, right? और तभी इसका dependence is also slow. 287 पर आए हैं तो true about epidural opioids are all except act on dorsal horn substantia gelatinosa, can cause itching, function of intestine is not affected, can cause respiratory depression. So what should be the answer? And your time starts now. So guys, time is over, and yeah, we are having a correct answer as well. Yeah. So guys, correct answer क्या है? Correct answer is the function of intestine is not affected, but yeah, it is affected. Function of intestine is affected. Patient will feel constipation. Then 288th question. Buprenorphine is partial agonist at M receptor, partial agonist at kappa receptor, partial agonist at M receptor, full agonist at M receptor, full agonist at K receptor. So buprenorphine क्या चीज है? And your time starts now. So it's asking that partial agonist at M on mu receptor, B is partial agonist as kappa receptor, and C is full agonist on M on mu receptor, and then full agonist on kappa receptor. What should be correct? So guys, the correct answer is A, partial agonist as at mu receptor. So buprenorphine is partial agonist at mu receptor, right? Mu receptor. Then comes the 289 question. Tolerance develops to all of the following actions of opioids except. Tolerance develops to all of the following action of opioids except meiosis, analgesia, euphoria, nausea and vomiting. So 29 question का क्या आंसर होगा guys? Your time starts now. So yeah, we are having the correct answer and still we are having 5 seconds. 5 seconds, 4, 3, 2, 1. So guys, tolerance develops to all of the actions except meiosis, right? So I hope आपको ये याद होगा. Constipation पर भी टॉलरेंस डेवलप नहीं होता एंड कंस्ट्रिक्शन ऑफ प्यूपिल पर भी टॉलरेंस डेवलप नहीं होता, right? So no tolerance develops. Then comes the 290th question. And an addict was presents with the increased sweating, lacrimation, diarrhea, yawning, rhinorrhea. These symptoms may occur due to withdrawal of heroin, cocaine, cannabis, or alcohol. So, what should be the correct answer, guys? Your time starts now. Your time starts now. Uh, 10 seconds are left. 3, 2, and 1. Yeah. So, guys, an addict presents with the increased sweating, lacrimation, diarrhea, yawning, rhinorrhea. So, these symptoms may occur due to the withdrawal of heroin. Heroin is correct answer. And yeah, we are having the correct. Uh, the next question is a newborn developed respiratory depression in a post-operative ward. It can result from the use of for newborn developed respiratory depression in the post-operative ward. It can result from the use of opioid, propofol, furosemide, or heparin. So your time starts now. So it should be the correct answer, guys. 10 seconds are left. Yeah, a newborn developed respiratory depression in the post-operative ward. It can result from the use of opioid. Right, opioid can cause respiratory depression. And on moving further, now comes the 292 question, 292nd question. So respiratory center depression can be caused by all except opium, stringent barbiturates, and gelsemium. Opium, stringent barbiturates, and gelsemium. 292nd question and your time starts. Time. So you'll be getting 30 seconds for this question. So 5 seconds are left, guys. Yeah. So respiratory center depression can be caused by all except stringent. So stringent cannot cause respiratory center depression. Opium can cause, barbiturates can cause, and gelsemium can cause. 293 क्वेश्चन पर आ चुके हैं and naltrexone is used for which of the following function in opioid addiction. So prevention of relapse, treatment of withdrawal, treatment of overdose, prevention of withdrawal. तो इसको थोड़ा ध्यान से करना. So for this I'll be giving you 50 seconds and your time starts now. So what is the correct answer, guys? Fifteen seconds left. So guys, time is over and I think we are having our correct answer. Yes. So answer A, and let's see. Naltrexone is used for which of the following function in opioid addiction? So that is A, prevention of relapse. B, treatment of withdrawal. No. Treatment of overdose. No. Prevention of withdrawal. No. Prevention of relapse is the correct question. Correct answer. 294 पर आए हैं तो all of the following can be used to treat heroin dependence: disulfiram, buprenorphine, clonidine, lofexidine. So all of the following can be used to treat heroin dependence except disulfiram, buprenorphine, clonidine, lofexidine. So time starts. Finally, guys, we are going to complete the 300 MCQs. 3, 2, and 1. So, guys, answer should be disulfiram because disulfiram is used in de-addiction of alcohol, right? But buprenorphine, clonidine, and lofexidine, they can be used to treat the heroin dependence, but disulfiram cannot be used, right? They act only on for the alcohol. So which of the following drug is not an opioid agonist? Heroin, ketamine, methadone, and codeine. तो इसका आंसर तो आप सबको पता ही होगा. बहुत ही ज्यादा इजी क्वेश्चन है ये. I think easiest question है ये. And for this I am giving you only 10 seconds. तो फटाफट से रिप्लाई कर दो. And yeah, we are having a reply. And yeah, you are right. Ketamine is not an opioid. Heroin, methadone, codeine, these three are opioids. But ketamine is not an opioid. So 295th का आंसर इज बी, दैट इज कीटामिन। 296 की बात करते हैं। तो naltrexone is used to maintain the abstinence following opioid withdrawal in addicts. It blocks all of the following features of opioid use, except euphoriant effects of opioids, craving for opioids, meiosis, respiratory depression. So, what should be the correct option, guys? So, your time starts now. So, guys, naltrexone is used to maintain abstinence following the opioid withdrawal in addicts. It blocks all of the following features like euphoria and effect, meiosis, respiratory depression, but it cannot block craving for opioids. तो ये क्रेविंग जो है कि स्टॉप नहीं हो सकती, मतलब साइकोलॉजिकल डिपेंडेंस नहीं स्टॉप कर सकता। दैट्स व्हाई दिस इज द ऑप्शन, दिस इज द करेक्ट ऑप्शन, राइट। एंड लेट्स मूव फर्दर। सो 297 क्वेश्चन पे हम आए हैं। एंड ऑल ऑफ द फॉलोइंग आर ट्रू अबाउट opioids except, so all of the following are true about opioids except naltrexone is short acting. Naltrexone is used to lower the craving in alcoholics. Nalmefene can be used for opioid poisoning, and nalmefene is shorter acting uh, than naloxone, right? So your time starts now. So 10 seconds are left, guys. And yeah, time is over, and all of the following are true about opioids except D. Nalmefene is shorter acting than naloxone. Nalmefene is shorter acting than naloxone. Yes, this uh right. 298 पर आए हैं, so we are approaching 300 का वाला target. So which of the following is not a feature of fetal alcohol syndrome? Microcephaly, low intelligence, large proportionate body, intrauterine growth retardation. And your time starts now. So 10 seconds are left, guys. Time is over, and correct answer is C. Large proportionate body. So basically, it is not the feature of fetal alcohol syndrome. But if there is a fetal alcohol syndrome to the fetus, then he would be having microcephaly, lower intelligence, and intrauterine growth retardation. But large proportionate body नहीं होगी, proportionate नहीं होगी. And 299 की अगर मैं बात करूँ, which of the following is least narcotic opioid? Least narcotic, right? A is morphine, then codeine, then heroin, and papaverine. So your time starts now. So 5 seconds are left. 2, 1. And guys, the least narcotic opioid is papaverine, right? And 300th क्वेश्चन पर फाइनली हम आ चुके हैं. तो 300 क्वेश्चन तक हम पहुंच चुके हैं. हमने 1 से लेकर 300 तक क्वेश्चंस कर लिए हैं. एंड नाउ वी आर हैविंग हार्डली 50 to 60 क्वेश्चंस लेफ्ट. तो फटाफट से ये कंप्लीट करेंगे एंड आज हम सीएनएस खत्म कर देंगे. राइट. एंड या एंटी क्रेविंग एजेंट for alcohol dependence are all except lorazepam, acamprosate, topiramate, and naltrexone. कौन सी ड्रग है guys? Your time starts now. So guys, D, that is uh, D नहीं. Anti-craving drug is all बेसिकली अल्कोहल डिपेंडेंस के कौन कौन सी ड्रग खत्म कर सकती है? एक कैम्प्रोस्टेट, टोपिरामेट, नाल्ट्रेक्सोन. बट लोराजिपैम नहीं कर सकती, राइट? लोराजिपैम नहीं कर सकती. तो एंटी क्रेविंग एजेंट फॉर अल्कोहल डिपेंडेंस आर ऑल एक्सेप्ट लोराजिपैम. Now come the 301 question. So the drug used to prevent the alcohol withdrawal in de-addiction is. So the drug used to prevent the alcohol withdrawal in de-addiction is diazepam, clonidine, propranolol, and methadone. So 301 ka what should be the correct answer? Your time starts now. So guys, drugs used to prevent the alcohol withdrawal in de-addiction is is diazepam, right? Is diazepam. And 302 की अगर मैं बात करूं, so the following symptom may be seen in opium withdrawal is the following symptoms that may be seen in opium withdrawal is constipation, lacrimation, dry nose, mouth, or constipation. Two times constipation. I think there is some error. तो बट फिर भी आंसर तो कॉन्स्टिपेशन है नहीं. So let's do this question. So your time starts now. So only 15 seconds are left, guys. Yes. So guys, इसका correct answer is B, that is lacrimation. So the following symptoms that may be seen in opioid withdrawal is lacrimation. And then comes the 303 in alcohol withdrawal, drug of choices. In the alcohol withdrawal, drug of choices, TFP, chlormethazole, chlordiazepoxide, and buspirone. So, what should be the correct answer? And your time starts now. So, 10 seconds are left, guys. So, in alcohol withdrawal, drug of choice is chlordiazepoxide, right? C. And 304 पर हमें है. So, which of the following drug is used to maintain the abstinence in the alcohol dependence? Abstinence. So A is naltrexone, B is clonidine, C is disulfiram, and then naloxone. So what is correct, guys? Time starts now. 10 seconds are left, guys. And yeah, we are having the answer. Answer already दे दिया है एक नंबर ने. So yes, C. No, C थोड़ी ना. C is wrong. C is wrong. The drug that is used to maintain abstinence in the alcohol dependence is A, naltrexone. Naltrexone, right? 305 पर आते हैं. So which of the following action is ascribed to delta type of opioid receptor? तो delta type के opioid receptor पर supraspinal analgesia, respiratory depression, euphoria, reduced intestinal motility. So what is the correct answer, guys? Your time starts now. So what is the correct answer, guys? And the correct answer is A, that is supraspinal analgesia. Which of the following action is ascribed to the delta type of the opioid receptor? That is A, supraspinal analgesia. So 306 की अगर मैं बात करूँ, morphine can be used in all of the following condition except head injury, asthma, hypothyroidism and diabetes. Morphine can be used in all the following conditions except head injury, asthma, hypothyroidism and diabetes. तो ये तो 10 seconds का है, हम अच्छे से डिस्कस कर चुके हैं, बट फिर भी आई एम गिविंग यू 30 seconds. लेट्स सी, अगर जल्दी आ गया तो वी विल मूव. 10 seconds left, guys. तो गाइस करेक्ट आंसर इज ए, हेड इंजरी. एंड आंसर आ चुका है. Morphine can be used in the following conditions but except head injury. हेड इंजरी के अंदर कभी भी मॉर्फिन यूज नहीं करनी चाहिए. हमने दो इफेक्ट यूज करे थे बिकॉज ऑफ द पिन पॉइंट प्यूपिल प्लस रेस्पिरेटरी डिप्रेशन. रेस्पिरेटरी डिप्रेशन की वजह से देयर इज एक्यूमुलेशन ऑफ द CO2. CO2 एक्यूमुलेट हो गई, देन ब्लड वेसल्स जो होंगी वो डायलेट हो जाएंगी. ब्लड वेसल की डायलेटेशन की वजह से इंट्राक्रेनियल टेंशन बढ़ जाएगी एंड दस क्राइसिस में चला जाएगा पेशेंट. एंड पिन पॉइंट प्यूपिल हमें प्यूपिलरी रिफ्लेक्सेस देखने में चाहिए. प्यूपिल आर इज बेसिकली यूज्ड टू डायग्नोस दैट हमारी थेरेपी अच्छे से काम कर रही है या नहीं, टू डायग्नोस एनी इम्प्रूवमेंट इन द पेशेंट. सो अगर पिन पॉइंट प्यूपिल होगा सो वी कैन नॉट सी एनी इम्प्रूवमेंट. दस हमें लगेगा कि हमारी जो थेरेपी है वो इम्प्रूवमेंट नहीं शो कर रही पेशेंट के अंदर. तो दैट्स वाई these are the two reasons जिसकी वजह से morphine is contraindicated in head injury, right? And why this video is lagged? तो 307 पर हम आ चुके हैं. तो naloxone is contraindicated in neonatal resuscitation if the patient is on cocaine, amphetamine, methadone or phencyclidine. तो इसके लिए I am giving you 30 seconds and let's see. So we are. I think there is a glitch. Chat में glitch हो चुका है यार guys. Chat में glitch हो चुका है. I cannot see your response. I cannot see your response. What's wrong with this? What's wrong with this? What's wrong with this man? What's wrong with this? पता नहीं कैसा glitch हो चुका है ये chat में. What's wrong with this man? So 307 का naloxone is contraindicated in the neonatal resuscitation if the mother is on methadone, right? 308 पर चलते हैं. Which of the following opioid has maximum plasma protein binding capacity? Maximum plasma protein binding capacity. Morphine, fentanyl, pethidine. So which of the following opioid has maximum plasma protein binding capacity? Morphine, fentanyl or pethidine? And for this I will be giving you 30 seconds. फटाफट से आंसर करो. So, what is the correct answer, guys? 5, 4, 3, 2, 1. And the correct answer is 2-fentanyl. This is having the maximum plasma protein binding capacity. And now comes the 309th question. The mu opioid receptor is responsible for the following effects: meiosis, tachycardia, hyperthermia, and bronchodilation. So the mu opioid receptor is responsible for the following effects: meiosis, tachycardia, hyperthermia, and bronchodilation. So what is correct, guys? What should be correct, guys? The mu opioid receptor is responsible for the following effects, that is meiosis. And 310 पे चलते हैं. The drug not used for analgesia in the patient of head injury is. तो ये चीज बताओ, हम अच्छे से डिस्कस कर चुके हैं. So 10 सेकेंड दूंगा, फटाफट से बताओ. Yeah, so we are having the correct answer, that is A, morphine. The drug that cannot be used for the analgesia in the patient of head injury is morphine. Morphine should not be used. 311 पे हम आ चुके हैं. Antidote for ethylene glycol poisoning is or are. Ethylene glycol का antidote is methyl violate, fluconazole, omeprazole, ethyl alcohol. So PGI का question है. So that's why more than one is correct. More than one is correct. So time is over, and I think we are having the correct answer. Antidote for the ethylene glycol poisoning is fomepizole and ethyl alcohol. So these two are correct. Fomepizole and ethyl alcohol. Now comes the 312 question, and true about methyl alcohol poisoning. So ethyl alcohol is used. Formation of formic acid produces blindness. Activated charcoal is given in all cases. Gastric lavage done. Fomepizole inhibits the formation of formic acid. तो क्या होना चाहिए इसका आंसर, गाइस? So, guys, we are having the correct answers: A, B, D, and E. So, methyl alcohol poisoning. Ethyl alcohol should be used. Yeah. Formation of formic acid produce by blindness. Yes. So initially blindness start होती है and gastric level done, yes. Formimazole inhibits the formation of formic acid, yes, right. And activated charcoal is not used here because it is a compound. It is not any. It is not a drug basically, right? True statement about dizosine is it is slower acting than morphine. It is less potent than morphine. It acts by GABA receptor. It does not increase histamine release. It increases the plasma catecholamines. So, फटाफट से बताओ the true statements about dizosine. So yeah, we are having the correct answer. True statement about dizosine is it does not increase the histamine release. It does not increase the histamine release. Rest all are false. तो 314 पर आ चुके हैं and morphine can be administered by all of the following routes except intramuscular, transdermal, epidural, subarachnoid, or oral. For this, I am giving you 30 seconds. Let's see. Let's see who answers the first. And I think time is over. No, still 10 seconds are left. So guys, time is over, and morphine can administered by all the following route except subarachnoid. Subarachnoid routes in nahi deni morphine, right? And 315 से बाद 315 question is established route of administration of morphine include inhalational, rectal, SC, IV, or IM. Established route of administration of morphine include inhalational, rectal, SC, IV, or IM. So what should be correct, guys? And more than one option is correct. And for this, I am giving you 30 seconds, and your time starts now. So another 10 seconds left, but still we are having our answers. Answer आ चुका है. Tech number, you are right. Established route of administration for morphine include B, C, D, and E. Rectal, subcutaneous, IV, and IM. And 136 की बात करते हैं. Which of the following statement regarding naltrexone are true? It is an opioid antagonist. It is an opioid agonist. It is used in alcohol dependence. It is used to treat opioid dependence. It is used as a respiratory stimulant. So it's a PGI question and more than one option is correct. So I'm giving you 30 seconds for this. So फटाफट से reply करो. Yeah, time is over, and the correct option is basically naltrexone is opioid antagonist. This is true. Opioid agonist, no, this is false. It is used in alcohol dependence. Yes. It is used to treat opioid dependence. Yes. It is used as a respiratory stimulant. No. So the correct option is A, C, and D. Right. P17 की बात करें तो the combination of alcohol and disulfiram results in nausea, hypotension as a result of accumulation of acetaldehyde, acetate, methanol, and ADH. So the combination of alcohol and disulfiram reacts in nausea, hypotension as a result of accumulation of. बताओ फटाफट बताओ. Uh, your time starts now. So the correct option is acetaldehyde, and you guys are also right, acetaldehyde. And let's jump to the 318 question. The intense craving experienced by the public recovering from the chronic alcoholism can be treated by a drug which acts by being an agonist of serotonin receptor, agonist of alpha adrenal receptor, agonist of beta adrenal receptors, antagonist of opioid receptor. तो 318 का क्या होना चाहिए? So what should be the correct answer, guys, of this question? So antagonist of the opioid receptor, D is the correct basically, right? So the intense craving experienced by the people recovering from the chronic alcoholism can be treated by the drug which is being an antagonist on the opioid receptor. 319 की बात करें तो which of the following opioid should not be used with MAO inhibitors? Morphine, pentazocine, buprenorphine, and pethidine. Which of the following opioids should not be used with MAO inhibitors? Morphine, pentazocine, buprenorphine, pethidine. So your time starts now. Yes, time is over, guys. Time is over, and the correct option is, so basically which of the following opioids should not be given with MAO inhibitor is D, pethidine. So the next question is 320th question पर हम आ चुके हैं. And disulfiram is used for the treatment of acute alcoholic intoxication, both physically and physiologically dependent alcoholics. Alcoholics physiologically but non-physically dependent on alcohol. Both A and B are correct. So disulfiram is used for the treatment of which of these four, guys? So your time starts now. So time is over, and the correct option is basically disulfiram anti-abuse is used for the treatment of alcoholics physiologically but not physically dependent on it, right? जो जिनको क्रेविंग होती है बेसिकली उसके लिए दिस इज द ड्रग, बट जो फिजिकली डिपेंडेंट है उसके लिए दिस इज नॉट यूज फॉर द ट्रीटमेंट. And 321, the rationale for using ethanol in methanol poisoning is that it antagonizes the action of ethanol, stimulates the metabolism of ethanol, reduces its blood level, inhibits the metabolism of methanol and generation of toxic metabolite, replenish the folate stores depleted by methanol. So your time starts. So guys, 321 ka answer is that it inhibits the metabolism of methanol and the generation of the toxic metabolite. No, it antagonizes the action of the methanol. No, replenish the folate stores. No. So guys, it stimulates the metabolism of the methanol and reduces its blood level. This should be correct, right? Yeah. Move. Let's move to the 322nd. The drug, which is a specific inhibitor of the enzyme alcohol dehydrogenase and it is useful in the treatment of methanol and ethylene glycol poisoning, is so the drug that is a specific inhibitor of the enzyme alcohol dehydrogenase and is useful in the treatment of methanol and ethyl glycol poisoning is disulfiram ethylene glycol, calcium, leucovorin, and formamizole. So your time starts now. So, guys, the answer of this question should be D. The drug, which is a specific inhibitor of the enzyme alcohol dehydrogenase, is useful in the treatment of methanol and alcohol glycol poisoning, is formamizole. Right. And now let's jump to the 323rd question. Use of the morphine should be avoided in all of the following patient except ischemic heart disease patient, bronchial asthma patient, elderly male patient, biliary colic patient. So, uh, बताओ. Your time starts now. And guys, A is the correct answer. So use of the morphine should be avoided in bronchial asthma patient, elderly male patient, biliary colic patient, but uh, it can be given in ischemic heart disease. So 324th question, पर आया analgesic X acts through opioid as well as additional spinal monoaminergic mechanisms. Which of the following can be X? Tramadol, etiquetaptazine, dextropropoxyphene L-fentanyl. 324th क्वेश्चन पर आए and your time starts now and फटाफट से बताओ. तो guys इसका आंसर should be A tramadol. Which of the following opioid analgesic act primarily to the kappa opioid receptors? So A is pentazocine, B is methadone, C is buprenorphine, and D is pethidine. And your time starts. So guys, correct answer is A. So which of the following opioid analgesic act primarily to the kappa opioid receptor? That is A pentazocine. And now let's move to the 326 question. Long-term use of pethidine is avoided because a metabolite of pethidine is associated with constipation, dependence, seizures, respiratory depression. So long-term use of pethidine is avoided because a metabolite of pethidine is associated with constipation, dependence, seizure, respiratory depression. Your time starts now, and it is really very easy question, guys. It's really very easy question. So yeah, time is over. And guys, correct answer is C, seizures. So pethidine का एक metabolite that is norpethidine is potentiate elliptogenic. So it can decrease the seizure threshold and thus it precipitates the seizure. And now comes the patient should be cautioned not to consume alcohol when given a prescription for any of the following except cefepime, cefoperazone, chlorpropamide, and metronidazole. The patient should be cautioned not to consume alcohol when given a prescription for any of the following except this. So 327 का फटाफट से बताओ. So इसके अंदर आपको ये बताना है कि कौन से ड्रग्स का डाइसल्फिराम लाइक एक्शन है. So guys 327 का is A, cefepime. Cefepime is correct. So basically, patients should be cautioned not to consume alcohol when the prescription of any of the following is given, except cefepime. Right? And yeah, tech number you are also right. 328 की अगर हम बात करें, which of the following drugs does not activate opioid receptors, has been proposed as a drug in the management of opioid addiction, and with just a single dose blocks the action of injected heroin for up to 48 hours. So कौन सी drug है guys ये? So which of the following drug does not activate the opioid receptor? Has been proposed as the drug of management of opioid addiction and with just a single dose blocks the action of injected heroin for up to 48 hours. So which is the drug guys? Your time starts now. So guys, correct answer is D, naltrexone, right? And 329 पर आए हैं तो which of the following drug is full agonist at opioid? Full agonist at opioid receptors has excellent oral bioavailability, analgesic equipotency to morphine, and a longer duration of action with milder withdrawal symptoms on abrupt discontinuation. So options are fentanyl, hydromorphone, methadone, and nalmefene. And your time starts now. So guys, 329 का आंसर क्या होना चाहिए? So 329 का आंसर होना चाहिए C and methadone. So basically, right. And let's move to the another question, 330th question. Which of the following drug reduces the alcohol craving and chances of the resumed heavy drinking by alcoholic after they have undergone the detoxification program with this drug? So क्या आंसर होना चाहिए? So the options are chlordiazepoxide, chloropropamide, methadone, and naltrexone. So which is the correct option, guys? D. Naltrexone is correct. Naltrexone is correct, guys. And let's move to the another question. So 331. A drug X is more selectively for the one type of benzodiazepine receptor. Basically, it has hypnotic action, but absent or little anti-anxiety muscle relaxant and anticonvulsant action. Uh, which of the following can be X? तो 331 का आंसर क्या होना चाहिए गाइस? चलो मैं ही बता देता हूँ zolpidem. Let's not waste more time. 332. A patient is having malignancy and has been suffering from severe pain. Which of the following opioid analgesics can be used as a transdermal patch for alleviation of the pain in him? So क्या आंसर होना चाहिए इसका? That is fentanyl, guys. Fentanyl. And 333 का in methyl alcohol poisoning there is CNS depression, cardiac depression, and optic nerve atrophy. These effects are produced due to formaldehyde, formic acid, acetaldehyde, pyridine, and acetic acid. So, what should be correct answer is A, formaldehyde and formic acid. And now let's move to the another question, 334. Drugs used in alcohol withdrawal are all except naltrexone, naloxone, acamprostate, and disulfiram. So the drugs that are used in alcohol withdrawal are all except. So naloxone is not used basically, right? Naltrexone, acamprostate, and disulfiram, these are used. 335 की मैं बात करूँ तो characteristic features of opioid withdrawal is rhinorrhea, lacrimation, seizures, delirium tremors, transient visual, tactile, auditory hallucination. So basically what is the characteristic feature is lacrimation and rhinorrhea. 336 की बात करूँ तो drug of choice for controlling severe pain in cancer pain is right. So which is the drug of choice, guys? Morphine is the drug of choice. And 337 पे अगर मैं आऊँ तो which of the following statement is false about naltrexone? Parenterally administered, used to prevent relapse of heavy drinking, long-acting, cause hepatotoxicity. So 337 का आंसर होना चाहिए parenterally administered. And 338 पे आए हैं तो dysphoria is mediated by which of the opioid receptor? Dysphoria is mediated by which of the opioid receptor, guys? Which of the opioid receptor, guys? Kappa receptor. और यूफोरिया किससे होता है? म्यू रिसेप्टर. And 339 का इन एक्यूट मॉर्फिन पॉइजनिंग द ड्रग ऑफ चॉइस इज। तो लास्ट एक क्वेश्चन पहले भी था जिसके अंदर डिस्पोरिया में मैंने म्यू कर दिया था, बट द करेक्ट ऑप्शन इज कप्पा। रियली सॉरी गाइस, पता नहीं कुछ ऑप्शन आया था, सो आई थॉट कि वो है। अब याद आ रहा है कि दैट वाज रॉन्ग। In acute morphine poisoning, the drug of choice is acute morphine poisoning. The drug of choice is so क्या है guys? Drug of choice naloxone. And this is the last question, guys. Naltrexone is used for which of the following poisoning? Naltrexone is used for which of the following poisoning, guys? Heroin, guys. Heroin. Naltrexone is used for the heroin. And guys, with this, let's end this session. And uh, let's end this session. Having few MCQs that are left, but let's end this session here only.